Today's lesson is going to be on charting chair side, and so I'm going to write out on an actual tray cover what you guys need to do. So in the last video I put on there how if you wrote everything out like the word change, then that takes a lot of time. But if you just put the triangle, which means change, that's really fast. So one of the things I do as soon as I seat a patient is I will put these cross marks on here for the upper right, upper left, lower right. And I will check for breakage. And so I take the scaler or the Sure instrument, and I will actually take the edge of, this is your Sure instrument. I'll take this edge and just kind of pull on the braces a little bit. So I'll take them, just kind of go around really quick and do a light tug on them. And if any of them are loose, so let's say, you know, we have a back molar loose and upper right central loose, then what I'll do is I'll put 6 and 1, and we know the upper right 1 and upper right 6 are loose. So looking at your schedule, do you have time to fix this? You know, they came in for, we used to call them AW2s, arch wire 20 minutes. And that arch wire 20 minutes allowed us to take a wire out, put a new one in, retie, and depending on how fast you were as an assistant, if you could actually have them go brush with the wire out, which I'm a huge advocate of. So putting that there makes it really fast. Or if I wrote out upper right 6 and 1, then you would know those are the ones that are loose. Then you want to ask the patient, hey, you know, what's going on over here? We have a bracket loose and a bondable band loose. Oh yeah, I was biting into an apple. So you want to put on there, apple caused breakage. Now, you might not think that's a big deal, but sitting chair side and taking these notes and typing them up efficiently is really going to be important when it's the 4th, 5th, or 6th breakage and mom's having a panic attack because the braces aren't off in time for senior pictures, okay? So you always have to be thinking, how would this look in court? How am I going to defend myself against, you know, parents that are upset because their kids pitching a fit? So make sure that you document what happened. I've had kids come in, I found the tip of an eraser off of a pencil lodged right in between the premolars, and it was like, really? You know, what happened? I don't know. Let me show you what happened. And so anytime you find stuff like that, document it, okay? So we're scheduled for an arch wire 20 minutes. If no one's on the schedule and it's, you know, a 9 o'clock appointment, go ahead and ask, you know, do you want to go ahead and get this taken care of today? We have time. Or do you want to come back tomorrow at 8 a.m.? We have an availability then. You never say, we don't have time for you today. You say, we have an opening tomorrow at 8, or we have an opening next week at 2 o'clock. You know, give them the choice, but don't ever say, we don't have time today, okay? So mom says, yes, we're gonna go ahead and put it on today. Now that arch wire 20 minutes becomes a 40-minute, take the wire out, clean the tooth off, clean the bracket off, rebond. You're going to be using a different setup. So for the arch wire change, you would need these instruments, and then you have these. So let's go over these really quick. You have your ligature cutters, which the sole purpose of these are to cut wires, okay? And mainly the ligature ties. You don't want to be cutting the arch wire with it. You have your distal end cutter, which cuts the actual arch wire. You have your Weingart that you use to hold the wire and put it into the arch wire slot. And the Mathau, it clicks and locks, and you take the little power O's and elastic ties and you place them on the braces, and we'll do that in just a little bit, okay? Then you have obviously your mouth mirror to look around, see if anything's loose. Hold the cheek out of the way if the doctor comes over and wants to look. You have your Explorer so that you can take the power O's off. And then you have your Sure instrument. This would be for tucking the stainless steel ligature ties. And then I use this in, like I showed you before, how to check if there's breakage. Okay, so I'm gonna put these back. And let's go over a few more things that you would want to take shorthand with, chair side, okay? So every office is going to have their own language as far as scheduling. So for us, we had a AW1, AW2, AW3. This was arch wire, 10 minutes, 20 minutes, 30 minutes. Everything was pretty much in increments of 10. So for these, an AW1 is a 10-minute check. So if you're closing space on a patient with power chain, then you would have on there, check power chain, change power chain, next appointment. If everything's looking like it should, change upper. So when you have the upper and the lower, an X above the line would be the upper, a X below the line would be the lower. Change upper, lower to a 20 stainless steel, 1825 stainless steel. And here's the other thing you really want to make sure you do. Check elastics. If a patient is in elastics, make sure you put it on there so that the next assistant comes in, she's reading or he's reading exactly what to do. Because if a patient is not good about wearing elastics and you're not checking them, you don't know to check them, then you could lose months of treatment because of that. So documentation is very important. Check headgear. HG is what we put for headgear. Check turning. I laid out here one of these. This is what the screw looks like. You have an expander in your mouth, right? So for this, you're going to want to check the turning on this. If I can get it open. So when we first put these, we tell you, hey, you're going to need an expander. We take your impression, we pour it up, send it to the lab, and this is what the expander looks like. And if you can see here, there's arrows on it, okay? The first thing you do, there's a little pole that you slide down and you bend it up, to fit down into the pallet, and then you make your other detail bends. So on this side, there's nothing. On this side, there's little arrows to show you what direction to turn it. And you always start, here's the little hole, okay? And you turn it towards the back, okay? And I could feel that turn, and then you take the key out. Now, the mistake that a lot of parents make, they'll turn the key, and then when they go to take it out of the mouth, they unturn it. And that's what you have to make sure you explain to parents, okay? This, I always put these on here because the parent can actually wrap this around their finger so they don't drop that key down the kid's throat, okay? So, you know, you put it in, you turn it, and then take it out like that, all right? You always want to have that safety added to it. So, go over turning, elastics, headgear. What else can you think you might want parents to know? Really big one. Anything? Cleaning. How do you clean this contraption? So, you've got this thing in the roof of your mouth. Certain things that you always check is OH, hygiene, headgear, elastics, and so oral hygiene. You look in there and, you know, some parents that know their kids are not great about brushing will say, oh, they just ate something on the way. They just had breakfast. Well, if you eat breakfast at home, then you need to brush before going out the house. If you're on the road, we give you a travel toothbrush. Make sure you're using that. You never want to sound accusatory though. You know, it's, oh, that's okay. Here, let me give you another travel toothbrush to take with you. It's very important that we get this clean. So if the oral hygiene is excellent, satisfactory, unsatisfactory, or poor. I never give excellent. That is reserved for like adults that are super good about cleaning. Satisfactory is usually what I see in teens and kids. Unsatisfactory, they're always coming in with a lot of plaque or food stuck in it. And then poor would be where their gums are swollen. You constantly have to go over flossing and brushing with them. And when you get to that point, you're going to want to talk about taking wires out and letting them get their brushing and flossing really good before putting wires back in. Will it set them back in treatment? Yes. Is it worth it? Yes. Okay. Why have straight teeth if they're all rotten when you take the braces off? So you'll circle one of these, and then headgear, we would always say 12 hours or more. So 12 to 14 hours. How do you figure out how long they're wearing their headgear? If I ask you, how long are you wearing your headgear? You've already heard me say, we want you to wear it at least 12 hours.
Isn't it that you have to make them try it, like put it on so they can see?
So if they can put it on without looking, they're wearing it good, okay? But what I do is I say, what time do you get home from school? 3 o'clock, okay. When do you put your headgear on? Oh, not till bedtime. What time do you go to bed? 9 o'clock, okay. Do you wear your headgear to school? No, you know, they'd be embarrassed. But some kids do, depending on their age. And then they say, well, I get up at 7 and I take it off. Okay, so then you do the math. You know, 7 p.m. until 9 p.m. until 7 a.m. How many hours is that? 10 hours. Are we getting the 12 hours we need? All right, so then that's when we're going to talk to the parents about if they get home at 3, have them put it on for 2 hours before dinner time. And then if we could get it, brush the teeth and get it on after, then maybe we get a total of 14 hours, okay? So educate the parents on that stuff, okay? And then elastics, again, I make those little hash marks. Elastics, write down the pattern, and know exactly what you need to check on next time. Is it a single class 1, single class 2, single class 3? Is it a box in the front? Is it a triangle? So, write that stuff down so the next assistant knows. Okay, any questions so far? Okay, so we have our arch wire appointments. An arch wire 2 is typically what we would schedule. And in that 20 minutes, you should be able to take an arch wire out, change the power chain, go over elastics. An arch wire 3 was reserved 30 minutes for upper and lower and possible bends. So what I mean by bends is if you have a tip back bend, compensating curve, reverse curve, step up, step down, step out the upper right 3. And so you see how this makes your life easier chair side, right? And for me, I type very fast. So when we went to laptops instead of paper charting, it was very easy for me to just type everything up, because I literally would just be like, tab, tab, tab. But a lot of times people skip over this important stuff. So let me give you a scenario. You're in an office and you have your patient and something gets broken. Now, do you charge them for it? No? But it's going to cost you $100 to fix it, get a new one.
Was it broken when they came in, or did y'all break it?
So, I'll give you a real scenario. So we had a little girl. She left the office pulling on her lower lingual arch, okay? You have bands on the 6s, and then it would be like that, okay? And this was kind of hold that arch while teeth come in after phase 1. And so I saw her putting her finger in there lifting up on the lower lingual arch, and I said, sweetie, don't do that, because it'll loosen it. You ever take a coat hanger and go back and forth, and it heats up and it breaks? Well, that's what happened. So she comes in, first time, there's breakage, lower lingual arch. I asked her what happened. She's like, she pulled on it. Okay, now I've got that documented, but have I done anything to correct it? No. So, had discussion with Dad, and lay out the specifics. Very important to not pull on the LLA. And make sure you document that you talk to Dad about it. Some kids would say, okay, and they'd go out and their parents wouldn't even schedule another appointment. They'd get in the car and leave. So then I would put there, parents left without talking, called Dad, and then had that discussion, okay? Again, in court, how's it gonna look? Oh, so the defense attorney's gonna be like, oh, so you dropped the ball, you didn't follow up with Dad, you expect a 9-year-old girl to understand all of this? I mean, they're gonna make you look stupid, right? So the second time she comes in, she has a bracket off on the upper left 2. LLA is out again. And I said, oh my goodness, how did this happen? She was chewing on a pencil. And so then the third time comes. And on the third time, I'm like, okay, well, in your contract, we talked about how if there's any breakage, We're gonna start charging $65 per breakage. We've reached that point. Dad got mad. And so I said, well, you know, let's look at your contract. I wanna make sure it's in there. Because if I try to charge him for something and it's not in his contract, you're breaking the truth in lending laws, and you know, they're gonna win that every time. So you wanna make sure that you have all three covered, documented, and so the next appointment she comes in for appointment 4 to get everything glued back in, fixed, Grandma brings her. Grandma's name and signature is nowhere on that contract. I said, it's gonna be $65. Can I see the contract? No, ma'am, you can't. It breaks HIPAA. Grandma didn't like that answer. So we had to call Dad. Dad cursed at me to show her the blank contract. I said, I wish I could, but I cannot break HIPAA. It's my mother. I said, I understand that, but her name is not on the contract. So Grandma storms out of the office without fixing the appliance. And so I documented big time on that. And then a couple weeks later, got a notice from the lawyer that, you know, because we were going to dismiss her as a patient, that, you know, they were upset that we had not gone over treatment well with them, that he was very busy, he was co-parenting. And so we actually won that case because of this documentation. And, you know, the lawyer said clearly, you know, he was a problem from the get-go, didn't even come back to check on the kid. She just walked up there and left. And while we're on this topic, if a child comes in, never say, go get mom. Always ask, who did you bring with you today? Because you don't know the situation. Like my kids, their father passed when they were 7. So if you were to ask them, who'd you bring with you, mom or dad? Well, mom, dad's dead. You know, you just want to be careful how you ask that. And the best way to say is, who did you bring with you? It could be grandma, it could be a babysitter, it could be an aunt, uncle. So, okay, great. Whoever brought them that day, document it, okay? Aunt brought Neff in today. Explained brushing, and the aunt said she would make sure that the parents know. Follow up with a phone call. Hey, it was really great meeting their aunt today. You know, this is what we went over. And then document phone call. Man, does that make you look good in court, right? So all of these things are really important when you're taking shorthand, when you're documenting, all of that stuff. Any questions about this? No? Okay. So you have your arch wires. The next thing would be bonding. We'd put bond 4 or 6. 4 would be 40 minutes, 60 minutes. Bond 4 would usually be a rebond, or if it was like bonding someone just for phase 1, like upper 2 to 2, that line there means the 1s are included in it. But if I said bonding the upper 2s, no line would be there, okay? So there have been some patients that we just bond the centrals and then come back and bond the laterals. So it just depends. But bonding, and then we used to have banding, but a lot of times now, instead of putting those rings around the back teeth, you have the bondable bands, which is really nice. So, all right, I'm gonna wrap it up there. Any questions? And then the next thing we're gonna go over in the next video will be the specifics about elastics.